Hello, this is Patrick Ring. This video is targeted toward federal retirees who have health insurance under the Federal Employee Health Benefit Program and are approaching age 65. This video illustrates how to determine whether or not one should enroll in Part B of Medicare. This illustration follows my particular situation, where my health insurance covers myself and my wife under the basic option issued by Blue Cross and Blue Shield. We are approaching age 65 and need to decide whether we need to sign up for Medicare Part B. Quick comment about Medicare. Medicare covers medical services and supplies in hospitals, doctors' offices, and other healthcare settings. Medical services are either covered under Part A or Part B. Medicare Part A covers inpatient hospital care, such as room and board, lab tests, drugs, and nursing services. It is available for all Americans and is free for most. You do have to sign up for it. Medicare Part B covers all other medical services other than dental, vision, and prescription drugs. It is optional and comes with a premium of $134 per month in 2018 or $1,608 annually for those with joint incomes of $170,000 or lower. If your joint income is more than $170,000, your premium is a little bit higher. Let's look at the analysis. Here is a table which illustrates what I would pay if I enrolled in Part B versus if I did not. Under my basic option with Blue Cross Blue Shield, I have to use a preferred provider, but I don't have to meet a deductible. The only thing I pay are co-payments. So in the first column of this table are different categories of medical services such as preventive care, physician care, lab and diagnostic care, hospital care, etc. The second column shows you what I would pay if I did not enroll in Part B. The third column shows you what I would pay if I did enroll in Part B. The fourth column shows you the savings I will realize if I do enroll in Part B, and is the difference between column 2 and column 3. Regarding preventive care, my basic option pays all the costs for preventive care, so enrolling in Part B gets me nothing. There's no savings there. For physician care where I get sick or hurt other than preventive care, I have a copay of $30 for a general practitioner or $40 for a specialist. If I enroll in Part B, I pay nothing, so the savings there are the $30 and $40 per visit. Regarding lab diagnostic tests, there are some tests that are free to me, but I'm on the hook for 30% of drugs agents that are given to me during the test. I'm assuming that's negligible. With Part B, I pay nothing, so in effect, there's no savings to me for enrolling in Part B. Other tests cost me $40. With Part B, I don't pay anything, so there's a savings there of $40. Again, I'm assuming the 30% charge for drugs agents is negligible. More expensive diagnostic services cost me $100 per test. With Part B, nothing. There's a savings there of $100. Again, I'm assuming the 30% of drugs agents is negligible. Moving on to inpatient care. Without Part B, I pay nothing. With Part B, I pay nothing. So there's no savings there for me enrolling in Part B. And I want to go back and explain this. Part A, Medicare, covers, as I mentioned earlier, the room and board, lab tests, and drugs, nursing services for the first 60 days. But it does come with over a $1,300 deductible. But my basic option pays for that deductible. So in effect, I don't pay anything for inpatient care under my basic option. Outpatient care, that's where you might come to the hospital, but your doctor has deemed you to be outpatient, not inpatient. Then I would pay $100 per day. And I've added on a cost for drugs because in this case this is probably a more serious condition. So I'm assuming the Blue Cross Blue Shield allowable amount for drugs is $100. So I'm putting in $30 for drugs here. So with Part B, I pay nothing. So I'm putting a savings here of $130 For surgery, it's $150 in an office setting or $200 in a non-office setting. With Part B, I pay nothing, so I'm saving $150 and $200 respectively for surgeries in an office or a non-office setting. Urgent care, I pay $35 per visit. With Part B, I pay nothing. Savings there of $35, and so on and so forth. Ambulance rides, it's $100. Emergency room care is $125 per day. Now, prescription drugs, we usually get preferred brands, so there's a savings of only $5 per prescription. And every now and then we get preferred specialty drugs. Again, there's only a $5 savings there. For physical therapy, we're saving, by enrolling in Part B, I'd be saving $30 per visit. For a specialist, for $40 per visit for a specialist, $30 for a non-specialist. And for chiropractic care, the same thing. The savings there would be $30. Let's look at further analysis. Here are 3 tables representing different levels of medical services usage. The first table, labeled Today's Baseline, represents our usage over the last 3 years. The medium increase in usage is just my opinion as what would deem to be a medium increase in our medical usage in the years ahead. And a large increase, again, it's my opinion as to what would be deemed to be a large increase in medical services over the next years. So under the Today's Baseline table, if we had 4 visits during the year to a general practitioner, if we got sick or hurt, would be the savings there would be 4 times $30. It would be $120 savings there. If we went to a specialist 4 times, that's 4 times 40. It's 160 savings. Now, this usage is joint usage together between my wife and I. All right, so I put in some lab tests here. I had 1 test for $40. There's a savings of $40. 1 test for $100. I'm saving $100 for that test if I do enroll in Part B. No visit to the hospital, no outpatient hospital care, no surgeries. Okay, so we usually go to urgent medical care a couple times a year because our physician is not available, but we are sick and we need a prescription. The savings there are 2 visits times $35 a visit. Savings of $70. No trips to the emergency room or ambulance rides. And prescription drugs, let's say we did 20 prescriptions in that year. Savings is 20 times 5, that's $100. Let's say we got 2 preferred specialty drugs. Savings there is 2 times 5, it's $10. The total savings for Today's Baseline is $600, which is the savings for not having to pay the co-payment. But you should subtract out the Part B premium, which I mentioned before was $1,608 per person. So if there's 2 of us, so that's $3,216. Then you add back in a reimbursement Blue Cross provides to each individual for the Part B premium of $600 per person. There's 2 of us, that's $1,200. For a net savings of negative $1,416. So this analysis is telling me that if I think our medical usage are going to match up with Today's Baseline, then I should not enroll in Part B. It's going to cost me $1,400 or so if I do. Let's look what happens under a medium increase in medical service usage. I just increased the number of visits to physician from 4 to 6, for a specialist from 4 to 6, increased the number of lab tests here, etc. Moving on down. Okay, so we had 2 incidents of inpatient hospital care, and the number of days, let's say, was 10, but it doesn't matter the number of instances or the number of days because Medicare Part A kicks in, and so there's no benefit to me for enrolling in Part B for inpatient medical care. I could change the instances to 3. No change in savings. I could go up from 10 days to 20 days. There's no change. There's 0 savings. On the other hand, outpatient care, one incident of outpatient care for a total of 2 days. Now the number of days is what counts, not the number of incidents. So 2 days times the $130 cost if I did not enroll in Part B is $260 savings if I do enroll in Part B. One surgery, there's a savings there of $150. 4 visits to urgent medical care, 4 times $35 savings per visit equals $140 savings. 1 ambulance ride, savings of $100. 1 visit to the emergency room for 1 day is $125 savings. The number of prescription drugs going from 20 to 30, this is 30 times $5 savings or $150. Number of preferred specialty drugs went up from 2 to 4, 4 times 5, $20 savings. Physical therapy required because of the surgery is, let's say 4 visits there, 4 times 40 is 160, for a total savings from not having to pay the co-payments of $1,845. Subtract out the Part B premium of $3,216. Add back in the Part B reimbursement from Blue Cross Blue Shield for a net savings of negative $171. Again, this is showing me that enrolling in Part B is going to cost me about $170. So I should not enroll in Part B. Let's look at a large increase in medical services. I just doubled the number of visits to the physicians from 4 to 8. And so the savings, let's say, for the specialist under a large increase in usage is 8 times $40 is $320. Increase the number of lab tests, diagnostic tests. With 3 visits to inpatient hospital care for a total of 20 days. Again, there's no benefit for me to enroll in Part B. There's 0 savings there. 3 visits for outpatient care for a total of 5 days. 5 times 130 is $650 savings there. 4 surgeries. 2 are in an office, 2 are out of the office, so there's the savings there. For the surgery not in an office, the cost is, or the savings is 2 times $200, which is $400. The number of visits to urgent medical care went from 2 to 5. 5 times $35 is a savings of $175 for enrolling in Part B. 3 ambulance rides will save me $300, 3 times 100, if I enroll in Part B. 3 days of emergency room care will save me 3 times 125 or $375 for enrolling in Part B. The number of prescriptions went from 20 to 40, so the savings there is 40 times 5 or 200. And this time, because there's multiple surgeries, the physical therapy visits went up from 0 to 12. And so 12 times $40 is 480 savings there, for a total savings from not having to pay the co-payments of $4,040. Subtract out the Part B premium of $3,216. Add back in the reimbursement from Blue Cross Blue Shield for the Part B premium for a net positive savings of $2,024. Now the consideration for medical inflation now. Pay attention that your total savings will increase if these co-payments increase because of medical inflation. This total savings here will increase. However, your Part B premium will also increase. How it will all net out is anybody's guess. So I think it's okay to use today's co-payments and today's Part B premium for making your decision about Part B. No need to worry about medical inflation. So how do you decide which way to go? Because you do not know what your level of usage will be. It will vary from year to year. Well, I went ahead and looked 30 years ahead. So that brings me to age 95. And I sat back and said, how many years do I think we will experience medical usage in line with today's baseline versus medium increase of usage versus a large increase in usage. So I looked at our history of our medical usage, then I looked at my parents' history of medical usage. So I think that 50% of the next 30 years, or 15 years, will match up with today's baseline usage of medical services. So I did 15 years times the net savings per period, which is the years per year, is 1,416, equals negative 21,240 savings. Then I said, I think 10 of the next 30 years will experience a medium increase in medical service usage. So 10 times the negative 171 savings per period is negative 1,710. And then I think that 5 years of the next 30 years, we will experience a large increase in medical service usage. So 5 times the positive 2,024 savings comes up with 10,120 savings. So you add all three up, today's baseline savings of negative 21,240, medium increase of usage savings of negative 1,710, and the large increased medical usage savings of 10,120 for a net amount of negative $12,830. This is telling me that if I enroll in Part B, I'm going to pay about $13,000 more over the next 30 years. Therefore, do not enroll Part B. However, that's at this point. There are other considerations you need that come into play here. And here I just copied the 30-year outlook again. Let me quickly change this back to the way it was. So here's the 30-year outlook based on what I think will happen is close to $13,000, negative $13,000 in savings. But there are special situations that I did not address above. It's prosthetic orthopedic devices. I'm on the hook without Part B for paying 30% of the Medicare allowable amount. So let's say in a certain year, the prosthetic orthopedic devices or durable medical equipment totaled $40,000. I would be on the hook to pay $12,000. With Part B, I pay nothing. At first hand, you think that the savings would be $12,000 for enrolling in Part B, but no. The basic option policy I have with Blue Cross Blue Shield has out-of-pocket limit, which you probably have heard it called catastrophic limit, for each one of us. If our costs during the year exceed $5,500, medical services thereafter are free. So what you do is, if you do have a large expense for like a prosthetic orthopedic devices, you take your out-of-pocket limit, you subtract out what you've already paid out-of-pocket during the year, and let's say that's $1,000. Your out-of-pocket limit balance is $4,500. So in this case, instead of paying $12,000, I would only pay $4,500. That's the actual savings. That does not offset this negative $13,000 savings up here. And let's say this happened in 2 years. So this would then be $9,000. Let's say my wife and I both experienced the $40,000 cost for these items. Double that to $9,000, that would not offset the almost negative $13,000 savings. So based on our situation, this is telling me to not enroll in Part B. But you should enroll in Part B if you think you're going to have many, many years of a large increase in medical services, a large increase in the usage of medical services. So let's change this 5 years to, let's say, 10 years, and the medium increase to 5. And so there, your savings has been increased by a lower negative amount. It's only negative $1,855. And then if you think you're going to have multiple uses of prosthetic or orthopedic devices, then you can see it will pay the savings you will receive from enrolling in Part B for prosthetic orthopedic devices will pay off. So that's it. I would appreciate any comments, feedback. And here's my email address, pringactuary@gmail.com.